Oh, how's everyone doing? My name is Dr. Shahid, and welcome to my YouTube channel. I'm just gonna be talking about some clinical related stuff so I'll just introduce myself. I'm a graduate of a medical college in Pakistan, and I am currently doing my intern year, and I'm about to start it in a couple of days. And I just thought that I'd make some videos to guide the juniors and make them understand some basic things about how hospitals work and what they can expect as an intern themselves if they ever get into that environment, which they will soon. So, so I thought of making a video about just the basics of how a hospital runs, just to give you guys an idea, because I don't know about the system out in the West, but in our at least in our system over here in the education system, they don't really stress on these things that much when you're in med school. We're more focused on the theory portion of our medical studies, and we don't really delve into the nitty gritty of the practical side of medicine, like how a hospital is, what you can expect, and how people behave, and what are the different departments and all that stuff. So the first thing that I would want to talk about is the general structure of a hospital. So, hospital has multiple departments, and they all have different roles, and all these departments work together to achieve a balanced aspect of patient care. All right. So, one thing that a lot of you've heard about is the OPD, or outpatient department. So, what is that? That is basically the area or the department that deals with patients coming in with non-acute complaints. So somebody who's not dying or who doesn't have some kind of illness that's severe, they present to that area of the hospital. Sometimes that doesn't happen. Sometimes they have something bad going on, but they present initially to the outpatient department or the OPD. So that does happen. So be prepared for that. Somebody could come in with an asthma exacerbation and they didn't go to the emergency, they came to you thinking that maybe it's not that bad, and then when you listen to their lungs, you find out they've got massive wheezing, and they look pretty bad, so you have to shift them to the ED and then give them the treatment. So outpatient department is basically for those patients that aren't acutely ill. So for example, a guy has a lump on his thigh or somewhere, and he's curious that what's going on, so he'll go to the outpatient department and he will see a doctor over there that's relevant to his complaint. So, maybe he's got some kind of skin disorder, like a lump. So he might think, okay, I have to go to a dermatologist. And he'd go over there, and then the dermatologist will see him. Or maybe he might go to a general practitioner initially, and he might refer them to the hospital's, outpatient department. So, so that's the outpatient department. Non-acute illnesses, they go over there, and you basically are in a very relaxed environment. You can talk to the patient and you can examine them without any worry about this guy's gonna die, or this guy's in a lot of pain, or he's all that stuff. So you can look at them and then assess them, and then make your decision about what you want to do. Do you want to admit them to the ward, or do you want to take them to the bigger areas like the emergency department or anywhere else? So that's very crucial. You have to know what type of patient you're dealing with. So that's the outpatient department in a nutshell. Non-acute people. Then the next thing you have is the inpatient department. So what's the inpatient? So basically, inpatient is basically, in layman terms, the guys that get admitted to the hospital. Those are known as inpatients. So the inpatient department can consist of the wards, it can consist of the emergency department, it can consist of the ICU. All these are inpatient units. Inpatient meaning the patient is in the hospital, he's staying in the hospital, and he is being taken care of there. In the outpatient, the patient can come and go as he pleases. You can give them a prescription, or you can order some tests. They go back home, and then they come back for a follow-up visit, and then you can deal with them accordingly. So that's the difference between the outpatient and the inpatient. In the inpatient, the guy is in the hospital 24/7, and he is receiving care for whatever ailment that they have. All right. So so again, I told you that inpatients can be divided into multiple departments. So it could be in the ICU, it could be in the ward, and all that stuff. So you put patients in the. I'll just go into detail about when you put these patients in the respective departments on based on what. So wards, patients go into wards when they are not critically ill and they're undergoing treatment for something, and they're not really super sick, but they are sick and they are being watched closely and monitored. So, or they could be undergoing surgery and they've been admitted and they're just getting all their pre-op stuff done, for which they have to be admitted to the hospital. And so yeah, the patients are sick, but they're not that sick to the point where they're like, you're like, oh, this guy's really ill and he needs like 24/7 care and stuff. So that's where the wards are. And what you should know about the wards is that to be a good intern in the wards, one needs to be in touch with whatever the patient is. Basically, you're monitoring everything the patient's been doing, like what they've been intaking, what their output is in terms of urine output or, water output. Uh, if they have any IV lines or if they're getting any medication, you should know what medications they've been given at what time and what dose. You should be aware of whatever thing that is being monitored, and you should accordingly follow it. Some surgical patients, when they're post-op, they have drains put in them, and you should be able to then monitor their drain output to see if there's any issues with that, right? Because you want all that gunk that's in the body to get out. So that's what a good intern would do in the wards. They should have a thorough idea of what the patient is undergoing, and they should be in tune with all their ins and outs, what their inputs, outputs are, what treatment is being given, and all their basic history. Um, so I think that's a major nutshell. Patients can become sick in the wards to the point, okay, there's one thing that I've learned is that a patient can get sick at any point in time. All right, so you need to be prepared mentally for the worst in all scenarios. Like, don't be like, oh, he's in the OPD or he's in the ward, he's gonna be fine. Patients can deteriorate at any given time. So always have your guard on and be ready for whatever comes. But usually nine out of 10 times nothing bad happens and things are manageable. So that's the wards. Then you go to the emergency department. So the ED is where the guys come, the basic thing when someone's like really ill and they're in a lot of discomfort, they go to the emergency department to receive immediate care, right? So that's where the ED comes in. So, and the ED is the area where you're mentally charged the most, to be honest, because a guy is coming in and this is their first time coming in. Usually, some people can come in recurrently for whatever complaint, but this is the first encounter you're having with the patient, and you don't know what they're undergoing and what's happening to them, and you have all these questions in your mind, and then you have to do a thorough workup of them. Get a history, get a physical done, do the relevant labs, give the relevant treatments, consult with your seniors that are on the departments, and accordingly then do the management. So that's the area where most of the action happens in terms of your medical profession. That's pretty much where you're going to have the most fun or most stress, however you want to look at it. But I think it's a mixture of both, to be fair. It's fun, but at the same time you do get a bit worried about certain patients when they come in. Some people come in really ill. In our setup, there's a lot of guys that are coming in with very severe illnesses, and most of the times it's us interns that have to deal with them. The residents are there, but they are usually preoccupied with so many patients themselves. So most of the time, this is what happens. We have to deal with them ourselves, and then obviously we are in touch with our seniors, and we take all their advices, and then we do the proper treatment. We don't take anything into our own hands. So that's an important lesson. Never take things into your own hands. If you're confused about something, always ask, and don't be worried about getting chewed out or getting shouted at or whatever. Like someone's that will happen sometimes. Some people are just overworked, and they could react with you in a not so friendly way. But don't take it to heart, and just do your job. Basically, that's what matters in the end, doing your job. So we got the inpatient, we got the wards out of the way, the ED, ICU. So ICU is where the most critical patients go. Someone has respiratory failure, they have lung, kidney failure, liver failure, their altered mental status. They're really bad. in terms of their health. They go to the ICU where they're monitored intensively. That's why it's called the intensive care unit. They get monitored intensively. So that's pretty, and I don't need to go into that much of the basics. You know what it's all about, critical patients. What you should know is that that's the area where you'll be mostly on your feet all the time as well, because patients can, at any given moment they could get really sick and desaturate or get worse. So it's good to be very alert when you go on these type of rotations. Get like a coffee or whatever you need to stay alert. Take that and get into these wards, these rotations, because they're going to be tough. So that's the basics of the inpatient and outpatient departments, and I think that's pretty much it for the basics of the what you're supposed to know as an intern. I'll make more videos about specific topics because it's very vast, and hopefully when I start my rotations, I'll be more in tune with the ins and outs of what's going on in the hospitals. So stay tuned, I guess, if anyone's out there. So that's it. Take care, and always keep working hard. So it's a privilege to be a doctor, and just be a good person overall. Okay, peace out.